Dizziness is a very common symptom that has affected most of us at some point in time. But of course, the term dizziness encompasses many things that we might be feeling. It might be a feeling of imbalance, or a feeling of lightheadedness, or an actual sensation of motion when we're not really moving, commonly referred to as vertigo. This is where we come in as a team of experts at Cleveland Clinic Abu Dhabi with a wealth of experience as well as expertise and equipment to help you and your dizziness that is affecting your quality of life. The key to managing dizziness is in making the correct diagnosis. This of course starts with a simple history and a conversation and better understanding how the dizziness is affecting you. This is followed by a clinical or a bedside examination, looking into your ear, examining you in the clinic, and then this helps guide special investigations. This might include scans, but in particular, we have a vestibular laboratory, specialized equipment to really help pinpoint, is this problem coming from the inner ear, is it from the brain, is it from vision, or a combination of these things so that we may tailor-make treatment options for you.
Here at Cleveland Clinic Abu Dhabi, we have the most advanced technique for balance assessment, such as VNG and posterography. For the VNG test, we use infrared goggles to measure and record a patient's eye movement in a variety of tasks and conditions. Sensory organization tests as a part of posterography help to assess the three sensory systems, visual, vestibular, and somatosensory, that everybody uses to maintain balance. We also do a posterography test, which is the computerized dynamic posterography. So the aim of the posterography test to assess the person's ability to maintain the upright posture in different environmental conditions, such as driving, walking on the beach, or any other everyday activity.
Please do not hesitate to contact us if you have any concerns in this regard.